Hey, Dr. Joel Baumgartner here. Super excited about some of the things that are happening here at Rejuv Medical. As you know, we specialize here in regenerative orthobiologics, which includes different procedures like PRP and stem cell type procedures. What those are, it's basically using your body's own healing ability, like PRP, for example, is taking a blood draw, grabbing those platelets, we separate those out in the lab, and we inject those back into different parts of the body, whether it's the joints, where things are degenerating, the ligaments, the tendons, the spine. And the goal of those procedures is to heal the body. The next step is something called a stem cell procedure or a bone marrow concentrate procedure, where we do a bone marrow harvest, take out the bone marrow, concentrate down those healing cells, and use those to augment that healing response. And those are actually much more powerful. Over the last probably 5 to 10 years, there's so much data, so much evidence showing that these cells can be used in orthopedics to help the body heal and repair. And why use those? Well, the main reason is we want to avoid things that are damaging. New studies are showing that things like cortisone injections into the spine or the joint actually causes more degeneration, more wear, more breakdown in the body. So the real goal in all of medicine is to avoid things that are harmful. Other things we're finding too, it's kind of surprising, but things like anti-inflammatory medications, those that are taking those chronically have 2 times increased the risk of a total joint replacement. So that brings us into more of the regenerative biologics, and what makes this different is we do something called the Rejuv Advantage. And it's a simple algebra formula actually. It's combining innovation plus integration, it equals optimization. So what's the innovation side of it? So it's what we do that's innovative, it's what's cutting edge, it's what's based on research, and it's based on technology. So the first thing we do, everything we do when it comes to these procedures is image guided. We either use the ultrasound or a fluoroscopy or an X-ray guided machine to guide these injections. It increases the precision, it increases the accuracy, it increases the outcomes of those procedures. In fact, I've written now 3 books on these types of procedures to educate doctors from around the world. So it's a passion of mine. The second thing is what we are injecting, the different cells that we're using. So we have a bunch of different kind of cell lines that we use, from stem cells to platelets to another version of platelets called platelet lysate, which is just the growth factors from the platelets. We can also do platelet releasates and platelet poor plasma, so all kinds of things we can combine to get the optimal outcome in the patient. And the last thing is how we approach those injections. I call it the Biotensegrity approach. Basically it means that we're not just looking at the knee, we're looking at all the different structures that are around the knee that contribute to the breakdown of the cartilage, which is the pain that you're feeling, or that meniscal tear. So it's not just like most places where they go in, they take their stem cells and they do a simple shot inside the joint. If I'm doing the knee, it's probably 20 different sites that we're injecting, from the cartilage to the meniscus to the coronary ligaments to your collateral ligaments, sometimes the ACL, and all those structures that stabilize the knee are also treated to optimize your outcome. Because you know the cause of the degeneration is multifactorial, including instability and wear of those other structures. So the second thing is, after innovation, is integration. And that basically comes down to how do we maximize the outcomes of these biologic procedures? And that comes to you. It's maximizing your health, your nutrition, your hormones, your micronutrients. All those things are other things we specialize in as well. So I'll oftentimes, the patients come in to see me to get their joints better. They'll go see our functional medicine department, they'll look at their hormones, their micronutrient levels, and they'll optimize those things to put themselves in what's called an anabolic state, a state where the body can actually heal and repair itself. We might combine things like IV nutritional therapy to also maximize the body's healing potential, or the newest thing we're doing now is something called extracorporeal shockwave therapy, which is an amazing technology that actually gets the body to heal and repair using acoustic sound waves without even having to use a needle. So we'll often combine those therapies before and after, also combined with physical therapy, which equals the rest of the algebra summary, optimization. When you combine the innovation plus the integration, you get those optimal outcomes. That's why people come to see us from all over the world.